And welcome back. I'm Mabel Jong. Thanks for joining us. We are talking with Titus Muzi right now. He is Senior VP, Managed Care Contracting at Aurora Healthcare.
Right.
So your experience in the healthcare space is long. You've been with a lot of different entities,
Right.
and now you're with Aurora. How do you bring that experience to what you're doing at Aurora?
Well, my background has been predominantly insurance. I spent some time with United Healthcare, with Humana, and most recently with WellPoint. And that insurance experience helped me to transition over to the health system, Aurora Healthcare, which is the largest integrated delivery system in Wisconsin. Mm-hmm. And I negotiated agreements for those insurance companies with health systems. So now I'm on the other side of that equation, right, negotiating agreements with the insurers on behalf of Aurora Healthcare.
In these different roles, and now finally at Aurora, can you see what things cost coming more transparent,
yes,
to the open market?
Yes, we've done some work in that regard. For example, I spoke this afternoon on a panel that talked about narrow networks, and we negotiated agreements with the 4 qualified health plans. When we negotiated those agreements, we moved around some of the pricing that they pay us. We moved to what I would call commodity pricing for about 30% of the healthcare spend. So services that are elective and diagnostic in nature or preventative, things like MRIs and CTs, therapy visits, mammographies, colonoscopies. We try to price those things with the qualified health plans at levels that are at market rates, so that consumers, when they seek services, they have a lower out-of-pocket. If they have a co-insurance, they'll likely have a lower out-of-pocket cost. So we did that knowing that going forward we're going to have to modify some of our reimbursement in order for consumers to get a better value.
Are consumers doing a good job consuming?
They are. I think the challenge has been on the insurance side, making that information available to consumers. There are multiple transparency tools out there for which individuals can access. The challenge has been, because I've been on the insurance side for the last 20-some years, the uptake of those consumers to that information has been very slow. And so the more savvy consumer gets at that, and what we wanted to do was we wanted to make those services affordable for consumers from an out-of-pocket standpoint. And our hope is that when they do start to really access that information, that we don't get deselected, that individuals will opt to stay within the integrated delivery system, and they won't go out because the costs for those services are a little higher maybe than a freestanding facility.
Where do you see Aurora taking this 3 to 5 years from now?
I think as we go forward under population health management, which is really our drive, and part of the reason why I was brought into Aurora was to try to move the organization from a contractual standpoint into more what I would call percent of premium or capitated arrangements, arrangements that pay a global reimbursement to us, and then we have to manage those costs within our health system underneath that. I see the things that we're doing now being instrumental for us to be able to manage our costs going forward, because the greater ability we have to manage our costs, the more able we are going to be to keep our operating margins at the levels they are, so we can provide the care going forward.
Absolutely. What is another takeaway that you're leaving with attendees at this conference?
Well, in our particular panel, we were talking about the narrow network concept and the qualified health plans. And I think the takeaway from that is that, in order to be able to provide consumers with a more affordable insurance product, they may have to limit their ability to access certain providers. And our goal is to have a broad, extensive network that provides the array of services that patients, consumers are going to need without really limiting their ability to access care. And that's been the challenge for us. And we've been very effective at it. We've had 3 years of experience now in offering a narrow network group product that we're working with Anthem. It's an Anthem product called Blue Priority at this point that has been very, we've seen a gradual increase from 7,000 members in 2013 to about 30,000 members here in 2016. So we've seen some success with that. So the message today was there may be different offerings, there may be different things that are going to be introduced into the marketplace, and we want to be on the front end of that. Absolutely. As a health system.
Mm-hmm. May I ask how the World Healthcare Congress made it onto your calendar? You must get a lot of different meeting invitations, but you chose to come here.
I did, you know, and I had never been to this conference before. I had had some mailings, and you know, with my schedule it just didn't fit, and someone reached out and asked if I'd be a part of the panel, for whatever reason it fit my schedule at this point, and I elected to do it, and I've been extremely impressed. Mm-hmm. In fact, have messaged back to several of my colleagues that this would be an excellent conference for them to go to. There were several presentations that I sat in on that I really got a lot of value out of. The most impressive was Dr. Withers yesterday. Yeah. You know, that to me, you know, some of us work in the financial area, we work on the periphery of healthcare. To see an individual like that on the street, you know, providing that kind of care, yeah. That was very powerful, I thought.
I'm sure it felt like that's why everybody does this job, right?
Right.
To kind of do what he's doing really grassroots.
Exactly, yeah.
Very cool. Yeah.
Excellent.
Thank you so much for your time today.
Thank you. I really appreciated it. Thanks for the time.
And I'm Mabel Jong. Thanks for watching. More to come.